And understanding blood sugar stability, insulin resistance, and diabetes. This is probably one of the most important topics I can talk about because it is something I have to educate patients on almost every single day. Nobody truly understands the relationship between blood sugar, calorie intake, the food you eat, and energy and function. And a lot of people come in to see me with diagnosis of chronic fatigue, chronic pain syndrome, brain fog, short-term memory loss, whatever it may be. And the number one underlying factor almost always in a lot of these people is they have completely unstable blood sugar and they don't have enough fuel or energy to function. And so they function in a depleted state all the time. So we're going to talk about this. And of course, the exact opposite is also the issue where people overconsume calories and overconsume foods that don't do them any favors with blood sugar and giving them energy, and leads them into a state of prediabetes or full-blown diabetes. And so we're going to talk about that as well. All right. I'm Dr. Ernesto Medina, founder of For Healing Health and Wellness Center in Round Rock, Texas, just outside of Austin. Our website is forhealinghealth.com. And you can find this webinar as well as all my past webinars on my website under the blog section. All right, let's get into a quick disclaimer. This information is not intended to treat or diagnose any conditions. Presentation is provided for informative purposes only, not intended to replace any personal medical advice you've gotten from your own doctor, especially regarding around diabetes. Every case is unique and different. And just because I talk about certain cases and situations on this webinar doesn't mean it'll apply to you. Every person is unique and different. And without personally going through your history and medication history, there's no way to know the advice or the recommendations I talk about here will work for you. Keep that in mind. All right, so a quick background on my training. I am a doctor of chiropractic. I've been studying postgraduate work in functional medicine and nutrition for the last 6 years, going on 7. This course, Karazian Institute, is, in my opinion, some of the most cutting-edge functional medicine education courses around. I occasionally get doctors join these webinars, so I just wanted to make sure I put this info here. Some of the slides I used in my presentation came directly out of this course, and you'll see the logo in the slides that I do use it. So I just want to make sure I give credit where credit is due as far as where some of this information came from. All right, let's get into it. So, like I said, diabetes, prediabetes is a humongous issue in the United States specifically. 1 in 4 people currently is diagnosed with either prediabetes or diabetes in the United States. And a lot more than that most likely have insulin resistance. We'll talk about that a little bit more, but that's not usually tracked or even diagnosed in conventional medicine, so it's never addressed until someone usually is already full-blown diabetic, which is unfortunate because early warning signs is the most important time where you can make the biggest effect on symptoms and stop the progression of certain diseases like type 2 diabetes. When I made this presentation, 68% of Americans were overweight or obese, and that is a direct risk factor for onset of type 2 diabetes. I made this last year, this presentation, so I wouldn't be surprised if that number is now higher. All right, so some of the terms we're going to be discussing in this presentation that I want to review with you. Dysglycemia refers to imbalance of blood sugar. Glycemia or glucose being the blood sugar, and dysglycemia, this being dysregulated, so imbalanced blood sugar. That can mean chronic highs, chronic lows, or alternating from high to low throughout the day. Insulin resistance refers to your body losing the capacity to get blood sugar into the muscles and into the tissues because the pancreas has been overproducing insulin usually for a long period of time, and your cells become resistant to using the hormone insulin to try to pull the sugar out of the blood and get it into your cells and into your muscles to use as energy. This is often what I like to call the pre-diabetes sign. So this is even before you become diagnosed with diabetes. Give me 1 second here. Oh, we got someone else joining us. Give me 1 second while I get them added in here. All right, so the insulin resistance, like I meant, and now metabolic syndrome. So metabolic syndrome refers to a condition, and it's a cluster of symptoms, a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. It includes high blood pressure, so HTN is hypertension or high blood pressure. It includes high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Aside from having a large waist circumference, most of the disorders associated with metabolic syndrome have no symptoms. Now, this is directly from, where did I get this from? Probably from the Mayo Clinic, I would imagine. I should have sorted that. But essentially, their definition of metabolic syndrome concludes with treatment can help, but this condition cannot be cured. So they're essentially saying hypertension, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels cannot be cured. And 1 in 6 Americans has been diagnosed with metabolic syndrome currently. All right. So I'm going to, in my presentation here about diabetes and insulin resistance, I'm going to challenge this notion that metabolic syndrome cannot be cured and reversed, because it just doesn't make sense. So let's talk about that a little bit more in detail. The metabolic syndrome diagnosis. And the reason this is so important, the reason I bring up metabolic syndrome is because, like it mentioned, it is essentially the precursor to the top chronic disease states that cause death in Americans, health-related death in Americans. So here's a more detailed diagnostic criteria. So any 3 of the following symptoms: high blood pressure, and that's a blood pressure higher than 130/85, a fasting blood sugar over 100. This is very important. Fasting blood sugar over 100. A waist larger than 40 inches for men or 35 inches for women. HDL cholesterol under 40 for men and under 50 for women. Now, HDL cholesterol is what's called your heart protective cholesterol. And then a triglyceride number over 150. Triglycerides is typically found on your lipid panel. So when your cholesterol gets measured, it shows up as part of your cholesterol panel, and it refers to how much fat is found in the blood. The primary driver of high triglycerides or high amounts of fat in the blood is overconsumption of calories or overconsumption of carbohydrates and sugars. In other words, this insulin resistant state. Okay. Now, the typical medical approach to this is going to be, and I see this time and time again, someone is either pre-diabetic or they become diabetic and they get put on this triad of medications. You get a cholesterol medication, you get your diabetes medication, and you automatically get put on high blood pressure medication. And why is that? Well, because of the entire metabolic syndrome state of having this combination of symptoms all linked together. All right. Now, if someone's been diagnosed with metabolic syndrome, chances are the underlying issues have been there for years. And I'll show you a timeline here in the following slides that the issue's been there for years. It's never been addressed, or nobody's talked to this individual about how to prevent this progression into full-blown diabetes and metabolic syndrome, and they've been allowed to continue their unhealthy habits and eating styles until they need all these medications, right? In the functional medicine approach and in my office, we strive to identify early warning signs of underlying contributors of these chronic disease states and attack and address them early to prevent the onset and the full diagnosis of something like metabolic syndrome or type 2 diabetes, right? So, like I mentioned, chronic high blood sugar, so eating too much sugar or too many processed carbohydrates, leads to an increased demand and release of insulin from the pancreas. This continues long-term for years and years and years, and now your cells no longer can utilize insulin efficiently, requiring the pancreas to produce even more insulin and more insulin and more over time until you become, and that is the insulin resistant state, and that continues for many, many years until you become full-blown diabetic, meaning your body can no longer pull the sugar out of the blood into your cells, and it just sits in the blood, causing high blood sugar. That is the diabetic state. Now, this combination of chronic high blood sugar and the high insulin leads to increase in belly fat, increases your risk for high blood pressure, your triglycerides go up, which also contributes to the high blood pressure. A high amount of triglycerides also leads to eventually fatty liver. So all that excess fat has to get stored somewhere, and it most often gets stored in the fat. Non-alcoholic fatty liver disease, left unchecked, eventually leads to cirrhosis of the liver, liver death. Poor cholesterol values is another side effect of this chronic high blood sugar and high insulin state. And then eventually the full-blown diabetic diagnosis, right? So this is a graph here of essentially the downward spiral of how chronic high blood sugar or chronic high insulin eventually leads to severe disease. And you can see here we have the first box, normal blood sugar. And then one of the earliest warning signs is going to be still normal blood sugar on a blood test. However, after a meal is eaten, that's what's referred to as postprandial dysglycemia. After a meal is eaten, an hour or two after that meal is consumed, if you were measured to measure the blood, you would find a massive amount of insulin and typically high blood sugar. But that's only found, it's only a very narrow window that can be seen 1 to 2 hours after a meal is eaten. And so in the conventional medical model, postprandial blood sugar and insulin numbers are not typically measured. And so that's a window being missed to identify early warning signs of diabetes and prediabetes, right? So that's the next stage. The stage after that is then insulin resistance. And that's where a fasting blood sugar may start to slowly creep up above 100, and a fasting insulin number will also be above lab normal ranges. Now, a fasting insulin number is also a very simple test that can be added on a blood test, but is never done in the conventional medical model. Oftentimes, I find cases with normal fasting blood sugar, but high insulin. And that again is an early warning sign of what's to come. After a person is in that insulin resistant state for some time, usually years, then they progress into, usually it'll be some sort of metabolic syndrome of either high blood pressure, the diabetes, the weight gain, or all of them together will start to happen. Right? Then progresses to the full-blown diabetic state where they need medication to manage their diabetes. And then you can imagine the end state is going to be kidney damage, kidney failure, one of the leading causes of kidney failure and the need for dialysis is uncontrolled diabetes, destroying the kidneys. And of course, uncontrolled high blood pressure also contributes to chronic kidney disease and the need for dialysis. And if you remember from my previous slides, one of the big contributors to high blood pressure is high triglycerides, which is directly caused from an insulin resistant state. I believe even the number one cause of amputations in the United States of feet and legs is uncontrolled diabetes. Okay, so let's give you a timeline. Now, this is just an estimate, but this is realistically the number of years it can take to progress from one stage to the next. So we have insulin resistant stage. These bullet points here are some of the most common symptoms of an insulin resistant state. And this is why I told you this is a topic we talk about and educate almost every day, is because look at the symptoms: fatigue, depression, pain, insomnia, obesity, infertility. And that's infertility because of its link with PCOS, or polycystic ovarian syndrome, and mood swings. And those mood swings can be irritability, depression, it can be anxiety. And how many people do you know who have that set of symptoms, right? And so if you've watched any of my past webinars, especially the mental health, holistic approach to mental health webinar, I spoke a lot about the role of blood sugar. Because look, the top symptoms, fatigue, depression, and anxiety should be added in there, all right? And in a conventional medical model, if you have those symptoms, what ends up happening? You get prescribed antidepressants, or you get sent to psychiatry and they prescribe you antidepressants and anti-anxiety medications, right? A common symptom that goes along with depression is insomnia. So now you also get prescribed sleeping pills. And if the underlying root causes are never truly investigated and addressed, insulin resistance can be a primary driving force of these symptoms. So 15 years, people can progress with these set of symptoms at varying degrees of severity over many, many, many years. And again, it never is looked into, it's never investigated into whether they have these underlying risk factors. And so they either get ignored, they get medicated with a medication that's not addressing the underlying root cause. And that medication oftentimes leads to secondary side effects that causes their own set of issues, right? So that's 15 years timeline, roughly. Some people are faster, some are longer. Then you get the type 2 diabetes diagnosis, right? Now you start to develop secondary risk factors like hypertension, dementia, cardiovascular disease. So your cholesterol numbers start to go up. Your lipid panel starts to get all skewed. Your risk for stroke increases because you're damaging blood vessels because of the high blood sugar. And that can go on for another 10 to 20 years. And then full-blown failure of the pancreas and the need for insulin injections to get that sugar out of the blood and energy. All right. All right, so let's go on to the next slide here. So that's why I said at the beginning, can a functional medicine approach prevent this metabolic syndrome, right? And if you Google it, and if you go to these medical institutions and read on metabolic syndrome, many of them will tell you it is not reversible and it can't be cured. So my question is, then, can a functional medicine approach prevent issues like stroke and heart disease and diabetes, kidney failure, right? The need for dialysis, amputations, and then poor COVID outcomes, right? And if you understand now how the underlying risk factors to metabolic syndrome which eventually lead to stroke, heart disease, diabetes, all these chronic health conditions, right? If you understand that the underlying root factors can be identified 15, 20 years before someone has a stroke or a heart attack, and those underlying risk factors are insulin resistance, prediabetes, due to poor dietary choices or lack of exercise, then in my world, these conditions are 100% preventable, right? If we talk specifically about COVID and COVID outcomes, if you remember, the highest risk factors for poor COVID outcomes, right, were, one was age, so being over a certain age. It started at like 65 and above, and it moved to 60, and then it was like in the 50s and above. So age was the number one risk factor. And why is age a risk factor? Because 92% of senior citizens have one or more chronic disease already, either high blood pressure, high cholesterol, high triglycerides, overweight, diabetic, so on and so forth, right? So that's why age was the number one risk factor. The number two risk factor, if it wasn't age, was being obese, overweight, or obese. That was number two risk factor. And then number 3, 4, and 5 risk factors were if you had other underlying chronic conditions like high blood pressure, high blood sugar, etc., etc. All the chronic disease states, which, if you remember from our timeline, likely started 10, 15, 20 years ago due to underlying contributing factors that were never addressed. So 100% better COVID outcomes can be the norm if the overall health status of the individual has been addressed previously and those chronic health conditions have been properly managed. All right, so this is a traditional USDA government-funded and government-supported food pyramid. And this was the food pyramid for decades, probably since if I were to guess, I want to say since the 1950s. This was the recommended dietary intake from the USDA. And you can see, sorry, it's so blurry, not a good picture, but you can see the bottom of the pyramid is the largest number of servings of this food that is recommended. Right, 6 to 11 servings. And what is that food group? Bread, cereals, rice, and pasta. All your processed carbohydrates. Right? And I think you get it by now. Processed carbohydrates and sugars increase insulin, increase blood sugar, lead to insulin resistance, and to the diabetic state. But for decades, probably over 50 years, if not more, I'm not 100% sure if this has even changed yet. This may still be the recommended food pyramid from the USDA, right? But if you eat this way, guaranteed, you'll eventually have diabetes, 100%, right? The next categories are your vegetables and your fruits. And then the category above that is going to be your dairy and your meat. And then, of course, they put the sweets and the fats and oils at the minimum amount. But this needs to be, let's rethink this, right? We have now enough thought leaders and nutrition leaders in the world and on social media doing research to show us that there are better ways of eating. If we look at what the latest, and this is the latest American Diabetes Association recommendation, you can see they actually changed the ratios a little bit to 1 serving of non-starchy vegetables, 2 servings of protein, and 3 servings of carbohydrates. So while they kind of are recommending a more balanced vegetable, protein, and carbohydrate they still recommend you intake the largest food group being carbohydrates and foods, 3 food groups. But if we take a step back to the previous slide again, right, we talked about the food pyramid. And where's the disconnect between the American Diabetes Association and the USDA food pyramid recommendation? I would guess they say, well, while you're healthy, you can consume 6 to 11 servings of processed carbohydrates a day until you become diabetic. Then you have to change your diet to more balanced vegetables, protein, and carbohydrates. But even this, in my opinion, and others in my field would disagree. If we look at the food groups, if you have the basic food groups, carbohydrates, proteins, and fats, the 2 food groups that do not cause a rise in insulin and blood sugar, for the most part, are going to be your proteins and your fats. So that only leaves carbohydrates. And carbohydrates almost always causes an increase in insulin and blood sugar. So if you're this individual who's insulin resistant, pre-diabetic, or already full-blown diabetic, you're not doing yourself any favors by eating 3 food groups, 3 servings of carbohydrates and foods. You're much better off eating higher protein and healthy fat with vegetables, right? So if we look at the keto diet food pyramid, it has completely flipped the USDA recommended food pyramid upside down. And here, the highest recommended intake of foods is going to be your fats, your healthy fats. So you got your nuts and seeds, you have your avocados, you've got dairy, you got coconut, olive oil, avocado oils, right? Because again, fats do not raise insulin and blood sugar. Then your next primary food group is your proteins. And then the last one is going to be your carbs. And really, those carbs are probably going to be mostly vegetables, very little fruit. And if the fruit's probably going to be berries, most likely, but even a small amount at that. Most of those carbs are going to be just vegetables, right? And this latest research is showing that this is probably one of the most effective ways to get diabetes into remission. And yes, it is possible. I believe the American Diabetes Association still denies the fact that type 2 diabetes can be put into remission. I believe it's also labeled as once you have it forever. But there certainly are many, many cases of type 2 diabetes being put into remission, people coming off insulin because they don't need it anymore, and coming off their diabetes pills, right? Now, I can tell you the keto, there's a lot of opinions around the keto diet. It is very strict and pretty extreme for most people and not always sustainable long-term. If you can do it, great. Most people can get a lot of benefit from it. But what we do in my office, especially if they're in the early stages of insulin resistance or prediabetes, is we try to optimize protein first and increase fibrous vegetables. So that's one of my primary focuses at the beginning, because that's a little more sustainable for most people and sustainable long-term. If we try that, and after a trial period of a couple months, blood sugar still hasn't improved or insulin levels still haven't improved, then we progress to the more strict keto diet format. But the majority, I would say 90-95% of people, because I do check early and we're able to identify early warning signs before full-blown diabetes sets in, the higher protein. And pretty much I tell people eat meat and vegetables. Meat and vegetables, and then you can enjoy your healthy fats like avocados and cooking with olive oil and avocado oil, nuts and seeds, no problem, right? But really focusing on protein intake. And this is something I've spoken a lot about in my previous webinars, especially the holistic health approach and the brain fog webinars, because the majority of people, at least I can't generalize, but the majority of people that come into my office and I consult with, the majority, like 99.9% of them, undereat protein. They're not eating enough protein. So that means they're either eating a lot of carbohydrates or a lot of fats. More often than not, people gravitate towards carbohydrates, bread, pasta, rice, processed packaged foods. And so that leads to a lot of their insulin resistance type of symptoms. So we flip that around. I have them focus on protein intake, and usually rule of thumb is about 1 gram per pound of body weight. It takes weeks for people to actually get to that point because it does take a lot of planning and preparing food, but that typically works for the majority of people really, really well. All right. Now let's talk about a little bit deeper into dysglycemia. Specifically, I want to talk about low blood sugar. Right? We spent most of the presentation talking about high blood sugar, but low blood sugar is also a pretty big issue. And low blood sugar we've referred to as hypoglycemia, right? Now, there's a lot of confusion around this because on a lab test, a glucose range will typically be between 65 to 99. If you go above 99, so you start to hit 100, now we consider that insulin resistant and pre-diabetic, an early warning sign in a fasted state. But as far as low blood sugar goes, once fasting blood sugar gets below about 80, so if your fasting blood sugar is in the 70s, 100% of people are usually having symptoms of fatigue, brain fog, low energy, sluggish in the mornings, or crashing, needing to take a nap in the afternoons. Okay. But again, a lab will tell you, oh no, that's normal blood sugar. Conventional medicine will tell you, oh no, that's fine. Your blood sugar is fine. But I can guarantee you, if fasting blood sugar is in the 70s, you're having a whole set of symptoms and you're not functioning at a very high level. All right. So what do we need to do? We need to either increase calorie intake, or we need to work on optimizing protein intake. And that's where a personalized approach of sitting down and having someone journal their meals for a week, what they're eating, what time they're eating, so we can get a rough idea of how much calories they're taking in and where those calories are coming from. I probably see low blood sugar issues equally as often, if not more often, than high blood sugar issues. And I'll give you a set of symptoms that often presents with this low blood sugar state. I had already mentioned the chronic fatigue, the chronic pain, the brain fog, the low energy all the time. That can lead to insomnia at night. So tired and wired. They go to bed at night, but for whatever reason, they're wired and they can't fall asleep. If they do fall asleep, they wake up multiple times through the night. And that means they're waking up even more tired, right? Maybe they're surviving on coffee or caffeine just to function, which causes more stress to the system and stresses out your physiology even further. And so they're stuck in this vicious cycle. They will oftentimes have low blood pressure as well. So they may suffer from fainting spells or get lightheaded often, or get dizzy often if they stand up too quick. They can often not tolerate exercise. They'll try to exercise, and 10, 15 minutes into some sort of exercise program, their energy will crash, or they'll develop a pounding headache, or they'll fatigue out very quickly and just feel terrible, or they'll start to get lightheaded and risk blacking out. And so all these set of symptoms run together with this low blood sugar state. I hope that makes sense. I had a couple of people ask questions on my Instagram prior to the webinar starting. So this is a very important variable when we talk about more complex conditions like POTS, which is positional orthostatic tachycardia syndrome, low blood sugar, dehydration, low blood pressure, just make the symptoms even worse. All right, so when we talk about adrenal gland function and adrenal stress or adrenal fatigue, the number one way you can chronically stress out your adrenal glands is not eating enough food. All right. All right, perfect. So I hope that made sense. I don't see any questions in the chat. Hopefully you enjoyed this presentation. We do offer free 30-minute consultations in the office and even virtually if you're a little far away and you're interested in finding out more. You can contact us through our website. You can give us a call. Website is the easiest, or even through my social media, you can reach out and I'll have my front desk get back to you and get you scheduled. Free 30-minute consultation gives you a chance to meet me face-to-face, chat about your personal health struggles or health goals, and how we can help. Perfect. So I hope you enjoyed the presentation. Our next presentation is October 10th, focusing on female hormone health, specifically PCOS and the infertility issue, the role birth control plays in those conditions, and of course, the role blood sugar plays in PCOS. Thank you. Have a good night. Thanks for joining me.